So, hello, I am Angie Gallagher, and I am a functional medicine wellness coach and also a very avid trail runner who has also had a baby and had my own issues with like healing my pelvic floor. And I just am really passionate about helping women understand and have the information that they need so that they can also um, deal with and improve pelvic floor health so that they don't have to be on the sidelines from running or only run alone. So I have Cassie McDonald on, and she's a physical therapist and specializes in pelvic floor. And so I'm super excited to just ask questions and get some amazing wisdom shared from her and how what she does and how she can help, and maybe some tips that people can be practicing also on their own to improve pelvic floor health. Welcome, Cassie. Thank you for being here.
Yeah, thanks for having me. I appreciate it.
Yeah, me too. Let's just start out with, for people who don't know, what is the pelvic floor and why should we care, especially as runners?
Yeah, for sure. So the pelvic floor is a set of muscles that lives at the base of your pelvis. So for pelvic floor physical therapists, we actually pay attention to all of the different types of muscles that make up this group, but we kind of talk about it as a generalized group when we're educating people. And the pelvic floor spans from the pubic bone to the tailbone and sit bone to sit bone. And its role is to hold our organs inside of our body, right? To help us to pee and poop only when we want to, right? So if you are sitting on the toilet and you want to pee and poop, you should be able to pee and poop. And if you are not wanting to pee and poop, you should be able to not pee and poop. There's also sexual function. So pelvic floor issues can manifest as any sort of issues with arousal and orgasm and pain with intercourse, those sorts of things. And then also, there is kind of this blood flow and fluid return component to the pelvic floor, right? So similar to if you experience, swelling in your ankles and feet doing some calf raises or ankle pumps or those sorts of things, the pelvic floor kind of has that role for fluid that just pools in our abdomen because we're up against gravity all day long. So if it's not working efficiently, we could actually see just holding a little bit more. Maybe that looks like bloat. Maybe it just kind of feels like there's a little bit more fluid in that part of our body if it's not working efficiently.
Wow, I didn't realize
And yeah, yeah. So we should care because 46% of women stop exercising because of pelvic floor dysfunction,
that.
right?
Oh my goodness.
And I heard a physician say once that the risk of being active is so much more worth it than being able to pay the risks of being sedentary, right? And so it's just a passion of mine to get information out about this part of the body because it is so limiting when there is dysfunction present. I like to say there's also this helplessness factor, right? When you have symptoms in this particular part of your body, it's not like when you wake up with a tight neck, right? And you know that you can throw some heat on it. You know that you can do some stretches. You know you've got this like arnica that you can put on it, right?
Yeah.
When we have symptoms in the pelvic floor, we don't have a great base education to know what is abnormal, what is normal, not wanting to talk about it,
Yep.
and then not really knowing what to do for ourselves and not knowing that there are people out there like myself that can help with these certain things, right? So the helplessness factor just drives the intensity of symptoms way up
Yeah.
to a super bothersome level. um, and so yeah, I just want to make sure that people are aware of this particular part of the body and that it does matter and it deserves healthcare as well.
Awesome. I love it. Now I do want to focus. I was really interested in pelvic floor health and specifically for women who want to return to running. But I have to ask the question, do men have a pelvic floor?
Men do have a pelvic floor, they just have less holes through it. um, and so there's a little bit of a less risk, right? Something that has more perforations through it is going to be more likely to have symptoms, right? They also aren't expected to push humans out of it. So that also does decrease their risk. Now, we do see that, women that have not had babies also have symptoms, right?
Mhm.
So having a pregnancy and a vaginal delivery are just a couple risk factors, but you can still have symptoms without that necessarily being in your particular history. And yes, men have pelvic floors. There are two holes through their pelvic floor, one for their urethra and one for their anal sphincter. And there are pelvic floor therapists that do specialize in seeing males for anything from urinary leakage, anal incontinence, like lots of farting or actually like losing control of stool. It's, prevalent in like the lifting community. And then also, erectile dysfunction, those sorts of things can all be treated with pelvic floor physical therapy.
Amazing. Thank you for sharing that. Because I think, a lot of people don't even realize that men have a pelvic floor.
Yeah.
And so I'm
Yeah.
really happy glad that you shared that. So you mentioned some indicators that there could be some pelvic floor dysfunction, but what
Hmm.
other, like other than like leakage, and you mentioned like
Hmm.
some bloating, what are some other indicators someone might have pelvic floor dysfunction?
Yeah, for sure. And just one thing that I want to touch on is it's funny, that there are a lot of thoughts that like men don't have a pelvic floor. And really, this particular part of our body are the same parts organized differently, right? So just based on chromosomes and hormone releases at the time that we're this embryo developing,
Mhm.
there is this like spectrum of development that can happen, which leads to a wide variety of anatomical differences, right? Even some intersex things, right? So I just
Mhm.
want to normalize that, like, this part of the body is the same in everyone. It's just organized differently depending on your particular genetics.
Gotcha.
Um, yeah, perfect. So go ahead and repeat the last
So
question.
some
Just
other
signs.
indicators, yeah, you already mentioned a couple things that could be indicators that someone's got pelvic floor dysfunction.
Yeah,
But what are some other things that could be the pelvic floor dysfunction could
yeah.
be the cause of?
Yeah, for sure. So I'm going to touch on kind of the three main things that I hear, especially in my active patients, as far as complaints about their symptoms. And then we'll touch on kind of risk factors for those
Okay.
particular things. So the main three that I hear is leakage,
Mhm.
just kind of broad spectrum leakage, whether that's leakage of urine or leakage of stool or, controlling gas issues. Um, Heaviness or prolapse considerations.
Mhm.
And then also just a lot of concern about diastasis recti, kind of a very popular term being thrown around in the pregnancy and postpartum community. And so those are kind of the like big three that I hear in my population that's more active. And then also, pelvic pain fits in there as well. Um, and some risk factors for the leakage and the heaviness and diastasis even is going to be assigned female at birth, just because of having more holes through that pelvic floor. Um, some anatomical, changes as far as like width of pelvis and mobility of hips and those sorts of things. If you had hip dysplasia, that will kind of, increase your risk factor. Um, Obviously, having a pregnancy, having a birth, whether it is cesarean or a vaginal delivery.
Mhm.
Um, for different reasons. There's, different kind of considerations for either of those particular types of delivery.
Okay.
Um, and then basically, how you have used your body in your life, right? And what your conditioning status is. We significantly decondition our pregnant women, pretending like postpartum is a breezy, easy breezy type of, phase of life.
Yeah.
Um, and so if you kind of go into pregnancy and early postpartum deconditioned, right?
Mhm.
We're not going to be very well conditioned for life after that and trying to either get into exercise for the first time or return to exercise.
Okay. So with that, then what are the chances that someone could go back to having normal pelvic function with
Yeah.
therapeutic interventions?
Yeah, for sure. And I always tell people, I mean, it's a risk threshold, right? If you're having these symptoms and it doesn't bug you, you know, do it up. Be
Mm-hmm.
active in spite of it, right?
Mm-hmm.
But obviously, if you're having these symptoms and they're bothersome and you're limiting yourself on your activity, my first question is, why are you limiting yourself in that activity, right?
Mm-hmm.
So for a lot of people, it's just fear, right? Like someone told me I should not do anything that makes me pee my pants because I'm harming myself, right?
Yeah.
Um, and symptoms anywhere in the body are just a sign of a threshold, right? So if it's knee pain and you develop knee pain on a run, you have the ability to decide, is this knee pain that I really need to listen to my body and I need to stop and modify what I'm doing?
Mm-hmm.
Or is this knee pain like, yeah, I can push through this a little bit, right? Is
Mm-hmm.
this knee pain during a race? Is this knee pain during a training run? And treat those symptoms similarly to that, right? Um, Severity of symptoms, the amount that it distresses you, do I have time to maybe recover from this a little bit more? Because we're not harming ourselves by having these symptoms. The symptoms are just a sign that
Mm-hmm.
there is a threshold there that we are not yet managing super well.
Okay.
And we can optimize function with things like pelvic floor physical therapy. We can optimize function of the whole kind of core system to improve that threshold tolerance and decrease the amount of symptoms that you're having through your activity.
Awesome. Okay, so what might that look like if people were curious, like what would pelvic floor PT, what would that entail?
Yeah. Yeah. So usually the first appointment that I have with people is just taking a look at all of the paperwork that they've filled out, right? And going through what we call kind of our 6 pillars of health and kind of chatting about, what role are your stress levels playing into this? What role is nutrition and how you're fueling your body playing into this? Specifically in the running community and, postpartum and those sorts of things, under fueling is a big issue. And the pelvic floor is a muscle group at the end of the day. And
Yeah.
so if we're under fueling, it will actually increase our risk for having pelvic floor symptoms, right? If those muscles aren't getting enough protein to recover, then we're gonna be more likely to have symptoms, right? What are your hydration habits? What type of exercise are you doing? What does load look like? Are you someone that does cross training? How quickly have you ramped load up, right? Like getting into all the nitty gritty of what has created your individual situation
Hmm.
and kind of talking about some things that can be started in just managing those things, right? Changing some hydration things, changing some fueling things, managing the load. I am not a physical therapist that shuts people down commonly. I try to kind of work within what my patient is wanting to do and willing to do. Um, and taking into consideration, mental health as well as physical health, right? Again, we're not harming ourselves if we're running and having some of these symptoms. So if we need to run for good mental health, great. Let's kind of figure out where we can make some changes otherwise. And then sessions will kind of jump into, I want to figure out what the pelvic floor itself is contributing to these symptoms.
Okay.
And then also, I want to figure out orthopedically what is contributing to these symptoms, right? What does core strength look like? What does hip strength look like? What does hip mobility look like? Then I also want to figure out what is nervous system contributing to this, right? So, do we have some sensitivity of that central nervous system, which is going to increase our irritability and kind of bother when it comes to some of these symptoms, right? And then I also will assess someone's running form, right? And see if we need to make any changes, right? Anyone that has experienced a pregnancy and postpartum knows that like there can be a lot of changes posturally that happen, right? There's a lot of form changes. Maybe we
Mm-hmm.
need a little bit more supportive footwear for a little bit just to kind of offload some things. And really looking at kind of how that entire lower body kinetic chain and core system work together in different symptoms that you're experiencing.
Wow, that's amazing. That is like super comprehensive.
Yeah.
And yeah, like more
Yeah.
so than I even realized. So it looks like
Yeah,
you're
I feel
painting
like that's
the full
what
picture.
quality pelvic floor physical therapy looks like. Unfortunately, where we're at in our current status as a discipline is there's not necessarily a great standard of care, right?
Okay.
So pelvic floor physical therapy can look like I was stuck in a room for 8 sessions with, someone with a gloved finger on my pelvic floor practicing Kegels to what I just described, right? And those two
Yeah.
things are completely different. So whenever someone comes to me and has had pelvic floor physical therapy before and said, this worked, this didn't work, we kind of talk about what did that pelvic floor physical therapy look like? And
Mhm.
how is that similar? How is that different with how I treat?
Yeah. So speaking of Kegels, is that something like if somebody were not in a position yet where they, had the time or
Mm-hmm.
resources, to be seen right now, is there something that they could do? I mean, is that something that a person could start practicing and see some improvement in their
Yeah,
symptoms?
I think, my answer to a lot of different things is it depends.
Okay.
It depends on what your particular symptoms are. If some of your symptoms are due to a pelvic floor that doesn't want to relax, then Kegels are not going to be the thing that fixes it. Kegels
Okay.
might actually worsen some of the
Okay.
symptoms, right? Um, and there's kind of this movement in the pelvic health world away from Kegels. There's this big anti Kegel movement on social media.
Okay.
And I'm somewhere in the middle. I
Okay.
think Kegels are helpful because it is muscle training. And we do know through our research that training this muscle group to have strength and endurance and, train quick twitch versus slow twitch activation does have an effect on symptoms, and we
Mhm.
need to manage all of the other things, right? So the pelvic floor contributions to symptoms, again, is just kind of like one of those areas that I'm looking at. And we need to make sure that we are strong and coordinated throughout the rest of the body, right, to kind of support that pelvic floor. So if Kegels are working for you, fantastic. If Kegels aren't working for you, then, think about trying to see someone that can kind of help figure out an individualized program. Or if you feel like you're a little bit more on like the, kind of hypertonic, carrying too much tension in that pelvic floor, I wouldn't like Kegels aren't necessarily the first thing that I'm going to give those people. I always say if you can't straighten your elbow, I'm not going to give you bicep curls to do at home.
Right.
So,
No,
yes.
that's super interesting. I didn't even realize that, like the hypertonic thing, like I hadn't considered that. So
Yeah.
really, really, really helpful information. And I think also like so encouraging for the people who are out there like doing Kegels all day long trying to improve and it's not making a difference. Like there's all these other things that are
Mm-hmm.
potentially contributing to your symptoms that can be addressed. So that's really
Absolutely.
super
Absolutely.
hopeful.
Yeah, and you touched on access, right? Access is really hard right now. I mean, my wait list is long. And people, wait to get into their provider and then get the referral, and then they've got to wait on a wait list to then get in, right?
Yeah.
And so that is something that I'm passionate at, like, educating the community on. I have actually created an online program that I'm currently running the first kind of live cohort through called Pelvicor. And it kind of, casts like right down the middle of the road. And is called Foundations to Function. So basically trying to build some of that foundation. We're working all the way up to functional strengthening and those sorts of things. And so just know that there are some programs out there that if you don't have, the time or the resources to get in with someone, looking for reputable sources that have classes or offerings, that might be a good kind of other option for people.
Awesome. That's really great to know. So what I'll do is when I post this, I will include a link if you have a link to your online course.
Yeah, for sure. So right now I'm running it as a live group.
Okay.
a live virtual group. But I do have plans to take those videos and kind of create a library where someone could self run themselves through the whole program.
Okay.
But the greatest place to kind of see my content is I post a lot to Instagram. So
Okay.
Cassie McDonald Ross DPT is my Instagram.
Okay.
And so people can follow me on there. I am also on Facebook as well, just to kind of see different content that I'm putting out there. And that's where I announce, where the next cohort will be, or if you can
Okay.
just, when you can kind of go on and just purchase the library of videos as well.
Fantastic. I love it. Is there anything that I didn't ask that I should have?
Hmm. I don't think so. I think just understand that when it comes to running, it is complex. There's, a lot of things at play. We work on breath work. We see, how strong are your hips? How strong are your quads? What is your running form looking like? Do you have mobile ankles, right? Because if we're not managing that ground reaction force well through the rest of our lower extremity chain, that just increases the amount of ground reaction force coming up into the pelvis and loading that pelvic floor, right? So that's a lot of what we
Wow.
work on when it comes to like form changes,
Okay.
and exercise prescription, for each individual person. It's not uncommon for people to have more issues running downhill than uphill. So in the trail running community,
Mhm.
just keeping that in mind, and a lot of that is due to the alignment of the rib cage and quad strength. So a lot of times, we're running downhill, and our first inclination is to lean back and kind of flare those ribs forward. And so one of the main things that I give people is, really try to cushion your landing running downhill and actually allow that rib cage to stay forward over your
Mm.
pelvis. So hopefully that's a
Wow.
helpful cue for people with
Oh my
running
gosh,
downhill.
so much good information. Like I'm like, all right, I'm signing up. I need to come see you. Like, I mean, not even just for the pelvic floor, but like everything you mentioned, like just like looking at all the parts of the body and how they all work together
Yeah.
as we're running. Um,
Yeah.
yeah, really impressive and great
Yeah. Well,
information.
thank you. And my biggest sticking point with the running community in general is just, don't sleep on resistance training, don't sleep on your strength training, and don't sleep on your cross training, right?
Yeah.
Um, because it all matters in helping to manage risk and risk of injury. And just know that those are the things that are going to help longevity in the sport of running, right?
Absolutely.
Um, and so if we're not doing those things and we're just trying to, run lots of miles, all week, there's definitely an increased risk of injury. Plus, we're risking not being able to do it for as long as we want to do it.
Such a great reminder. So yes, if you're watching this, like, yeah, take that to heart. So many runners end up on the sidelines because they didn't do the other stuff. That's
Yes.
just so
Yep.
important. And I've been guilty of that myself. So it's a great
Hmm.
reminder. Awesome.
Absolutely.
All right. Well, I really appreciate it. This has been super, super informative. So appreciate it very much. And I will definitely link to your Instagram and hopefully people can either get in with you or at least get into your class or your library of videos.
Yeah. Perfect. Thanks so much. I appreciate it.
Yeah, yeah, my pleasure. Me too. Okay, bye-bye.
Bye.